what can I tell you first about We Get It? We're a charity working alongside anyone who's affected by cancer, any age, any gender. We pride ourselves on bringing together a community and giving support and information for cancer patients and their families and their friends. We also like to do things a little differently at We Get It. We like to tackle head on some of those tricky subjects that people find it difficult to discuss out loud. One person who's never afraid to say it out loud is our guest tonight, the irrepressible, invincible, wonderful Deborah James.
Oh.
Deb, I think there are many people here tonight who will have followed your cancer story through every tweet, every Instagram story, every news item, every podcast. But for some of those people who are perhaps not as familiar with Deborah James or Bowel Babe, can you tell us your story?
Absolutely. And first, before I delve into it, I just want to say a massive thank you for having me here. I actually, Sarah will correct me with this, but I think it was probably a good couple of years ago that I came to Bath, almost when you guys launched, actually. And myself and my mum used it as an excuse to come and stay in the wonderful Bath and visit the Roman baths and have tea in the Crescent Hotel. And it was a good excuse, basically, in that pre-COVID time. What struck me about the event that I was part of a couple of years ago was just what an amazing community, local community actually, that wanted to obviously reach out and widen on a national scale. But it was brilliant to see people from the local hospices, from people from all different walks of life in terms of all there together. So it was a really nice experience. So it's lovely to be back here, albeit virtually, and I can't wait in maybe, I don't know, 6 months, as soon as we can, to come back down and actually visit Bath again. So I was diagnosed in 2016 at the age of 35 with metastatic bowel cancer. I suppose my life before cancer, I think, is quite significant actually, in terms of loads of people will hopefully relate to this. I was a busy working mum of two, so you know, I don't make any kind of shyness over the fact that I loved my job. I still, you know, am passionate about teaching. I used to be a deputy head teacher in a secondary school, and I was doing what many of you guys are probably doing, which is just juggling stuff. So you are running the kids to nursery, picking them up, and you know, as they're waiting on the door at 6 o'clock, and then you're going back. And I suppose everything else came first apart from my health. And about a year before my diagnosis, I just started to have a change of bowel habits, but I have always had a bit of a dodgy tummy. I've always been somebody who's had IBS. And I say that in terms of I've just always put my dodgy stomach down to anxiety or whatever it is. Unfortunately, as a result, when things started to get serious, so my change of bowel habits turned into frequency of going to the poo, like basically up to about 8 times a day at the time. And the key difference was when I started pooing blood. But obviously, being young, I started Googling it. And I mean, you know, you never Google stuff because you either end up in a rabbit hole or you end up reassuring yourself and actually you need professional advice. And I thought it was hemorrhoids. I think the doctors thought it was hemorrhoids. And unfortunately, it got to about 6 months later in a non-COVID climate. And this is quite important because my diagnosis took 6 months in a regular climate to then be told that by the time I'd actually had a referral for colonoscopy, I had a 6.5 centimetre tumour in my bowel, and I also had 8 tumours in my lungs. So I was already metastatic bowel cancer. That's an irregular climate, and I know we're going to come on to what, you know, the impact in this climate alone. So since 2016, unfortunately, with bowel cancer, and I know that there'll be lots of people listening in today who are patients, so please close your ears if you don't want to hear this. But without kind of beating around the bush, the earlier bowel cancer, any cancer, in fact, is diagnosed, the better. And with bowel cancer, unfortunately, when it's metastasizes stage 4, less than 1 in 10 people will survive for 5 years. Now, I'm 4 years down the line and I have hope, and I know that those statistics are changing. I know that there may be people listening in today who are also family members who know full well that those statistics are very real. And I see that first, very, very closely. So on one hand, I am very scared about the statistics, and on the other hand, I feel incredibly grateful to still be alive. On the other hand, when bowel cancer and lots of other cancers are caught really early, say stage 1, over like 95% of people will survive. So we are really talking about the difference between life and death. Without going into too much detail, over the last 4 years, I am continuously on treatment. I've had a bit of a roller coaster in terms of going from disease-free. I say that on paper. I think anybody who lives with cancer will understand that actually when cancers metastasize, only time will tell if you are ever disease-free. But essentially, I am continuously on treatment to manage or put to sleep my cancer. That has involved lots of major operations, from lung resections, bowel resections, recently a kind of chest resection. I've had lots of ablation. I've had CyberKnife, which is a really targeted type of radiotherapy, and I'm currently kept alive by some targeted drugs. I was one of the first people in the country to be on those drugs, campaigned for them now to be approved on the NHS. I was the case study, actually, which is probably the proudest thing that I am, well, the proudest thing for me, actually, that I've been involved with in my cancer journey, is to ensure that anybody with my type of cancer will have access to my type of drugs. And I am due for treatment tomorrow, and just ploughing on like the rest of the nation, I think. So that was a long-winded way of saying I'm still alive. I'm very, very grateful for it.
So Deb, I mean, we're all thrilled that you're here and that you look so fabulous. But rolling forward from your initial diagnosis, what we have now is, well, tantamount to a sort of perfect storm, if you like. So a global pandemic, meaning that cancer doctors and nurses are then deployed somewhere else. A cancellation of some drug trials, screenings, treatments, a general public who, for all the best reasons in the world, have listened to the message that says stay at home, protect our NHS, as well as people perhaps frightened or nervous to go and see their GP because of COVID. So you have this perfect storm here, all of which could amount to what some experts are saying is another pandemic, and that's the cancer pandemic.
Yeah, I think so. I suppose as somebody in the cancer community who cares passionately about it, and I know that anybody listening in, we all care very passionately about it, because it affects us. It is, affects our loved ones. And for me, I've always got my teacher hat on, and probably always trying to not change the system, but certainly improve the system for the better. For me, the thing that shocked me, and writing about this every week and broadcasting about it, was just how dramatic the fall in referrals were. So most people, like myself, are diagnosed with cancer when they go to their GP. And during the first lockdown, we had a drop by 75%. I mean, that's huge in terms of it was literally thousands and thousands of people sitting at home with undiagnosed cancers. And of course we can get political about this, but I think we're not going to go there, are we, in terms of kind of that conversation? Sorry, Liz, what were you going to say?
No, I was just going to say, do you think it was that whole mixture of people being nervous or definitely not wanting to overwhelm the NHS? Do you think it was that?
No, I think it was partly that, but I also think that anyone who's been diagnosed with cancer will know that unless you've ended up in A&E when the cancer has got arguably so advanced that you need to have treatment there and then, to catch cancer early, you have to really know your body, know the changes, and almost kind of pester your doctor when you're not quite sure if it's anything serious, really. I call it, well, doctors call it, in fact, the door on the handle question. It's the question that you've popped in for because, I don't know, you can't sleep at the moment, or you're feeling a bit blue, whatever it might be. And then just as you leave the GP surgery, it's like, oh, by the way, I had a bit of blood in my poo the other day, or I've got a lump here. And I think it's, people always go, oh, don't worry, it can wait. And I think, even in a regular climate, I thought my change of bowel habits, which happened to be metastatic bowel cancer, could wait. I know it can't, and I think it's that double whammy, isn't it? It's that double whammy of people thinking that they can wait. And it's reminding people that, yes, COVID is hideous. I've got, I'm going to say this from the outset, because I don't think we should sit here and talk about COVID versus cancer. I've currently got two family members who are in hospital, critically in hospital, ill with COVID. I don't live near them. They live down in the West Country. And I can see the impact that, how hideous COVID can be on a family. But I also can see how cancer is. And I take my hats off to the medical staff who are making these heartbreaking decisions.
Mm. And in terms of COVID, how do you think or can you explain to us how you think it's affected you, knowing what you know about your treatment, particularly in lockdown? How have you felt about it?
Yeah, I think COVID has really impacted cancer patients in a couple of different ways. I mean, from my own personal experience, one, I was scared of it, actually, to be honest with you, scared of catching it, knowing that I was part of the extremely vulnerable group, as anybody with on active cancer treatment are. It was this idea of lock yourself away and kind of, let the rest of the world deal with it. Mentally, I think that is incredibly hard. And then I think it was as somebody who literally, I've said this before, rising on the wings of science, all we have as a community is hope and options, and we want access to the best care, the best hope, the best research. And when COVID comes and shuts that down, when we are scared whether we're going to get treatment, when we are hearing, and it's very real, case studies of surgery being cancelled and difficult decisions being made, I mean, that absolutely sends kind of fear through me. So I think mentally it's been an absolute challenge. And then just physically, I mean, just as a small case study, the first lockdown, I had 3 weeks of radiotherapy. I was incredibly grateful to have that radiotherapy, but mentally and emotionally doing that every single day on your own. Yes, I have my family at home, but I think people maybe listening in might recognise a lot of the coping mechanisms that we have to get ourselves through chemo, to get ourselves through radiotherapy, might be going to see a friend, go just, I don't know, sitting in a coffee shop, sitting in a restaurant, whatever it might be. For me personally, it's that distraction is my coping mechanism, and actually suddenly everything is taken away.
Yeah.
And I know it sounds really, well, not pathetic, but you kind of just have to get on with it. But then I had an operation. I was in intensive care just before Christmas, 2 months ago now, and again, you kind of like, if you're given an operation that might save your life, you grab it with two hands. But mentally, it's not easy. And at 3 o'clock in the morning, when you've got quite a lot of drugs pumped into you and you can't see your family, you can't mentally almost fathom how you even, everyone's like, oh, use social media. You can't. When you're ill in hospital, actually, it's the last thing you're capable of doing. And I would say mentally that took a very, very big toll on me. Just kind of picking myself back up. But I'm very grateful to have my family around me. But I had to go and isolate away from my children for a month beforehand, because it was the only way to ensure that I was safe enough to have an operation and safe enough afterwards. But it's kind of one of those things where, like, we all know, and listening into this, all of us are having to make sacrifices, whatever that looks like, whether that's job losses, whether that is being away from our families. And so I think it's one of those things where, as much as we hate it, actually, we have to play our part in it, don't we?
And last year, 2020, you made the Panorama programme Britain's Cancer Crisis, which highlighted the impact of the coronavirus on cancer. When you were making the programme, I mean, obviously you're part of a cancer community and you know it, you're on the ground with it, so that, there can't be that much that surprised you. But was there anything that, when you were making it, even you were shocked or surprised about facts or figures or anything really?
Yeah, I think so whilst I've always known this, I don't think I've seen it in practice as much as what I saw when I was on the road with Panorama, is just the disparity in terms of kind of postcode lotteries. And I live in London and I'm treated at a major cancer hospital, and my experience there is great. Of course they've had their own challenges and I've seen the impact. But on the whole, in terms of access to treatment, I think I was not naive, but I think I just assumed that, but people do have access. And then I think when I got on the road, I didn't quite realise how kind of, yes, in major places, absolutely, but actually in some places, for example, at the moment, there's been a kind of in response to some cancer surgeries being cut, there's been a letter that's gone out to all NHS trusts across England, ensuring that P1 and P2, so that means priority cases where urgent cancer cases are needed to be operated on, are not cancelled. However, what I've then realised, just from my conversations, is actually it's left down to trust level, and it's just like working in schools. And as my ex-deputy head teacher brain comes on here, and as much as I go, it's not fair, but we can't blame the people on the ground, because they are probably, I know from the stories that I'm hearing, is that it's just as heartbreaking for the oncologists or the surgeons to have their list cleared, to be fighting to get that surgery space. But then what do you do as somebody whose two relatives have just been blue lighted into a hospital? Do you close the door and say, no, I'm about to operate on somebody? How you manage this is so beyond kind of my thinking, and it is really kind of frustrating. Is it fair in terms of just how much we kind of didn't ring fence cancer care? No, I think we didn't learn. I'm hoping that we will take from it that we didn't ring fence cancer care as much as we should have done, and we will see the collateral of that. And I think we all know that. That's probably maybe why we're joining in this conversation today, is that we probably all have a feeling about that, in terms of, hang on a moment, why are we not ring fencing when 165,000 people will die each year from cancer? 1,000 people are diagnosed every day from cancer. 450 people will die each day and they don't get headlines. And so I think, as somebody in the cancer community who wants to kind of remind people that cancer is still going on, there is that frustration. But then what do you do?
What do you feel that the program, which I thought was a fantastic program, do you think it had an impact? I mean, has anyone, since, any health professionals, been in touch with you to tell you more or ask you more?
Yeah, I think it got people talking, which I think is good. I think that's what you want from these things, is you want people to think, and you want positive change. You don't want, it's all good and well people moaning, but I think unless there's a solution to it, or unless it creates change in a positive way that's only going to impact the cancer community, then actually, let's not waste our energy. We want to put our energy into making positive change. The thing that I've seen is, from healthcare professionals, it's one of those things where a lot of people will say, actually, we know it's happening. I've realised just how much healthcare professionals, such as oncologists, they want to ring fence cancer care as much as we as patients want to ring fence cancer care. And actually, I have found that people are very supportive of those messages. What I've also found is that actually there's no point in lots of us going off. We have to all come together as communities, as charities, as the cancer community, and actually rally around a common goal. Because I think sometimes in the cancer community, it can feel never divided, but it can feel a slight hierarchy in terms of like getting space for types of cancers or whatever it might be. And ultimately, I think we have to take hope from looking at how we've come together over a COVID vaccine. Like, imagine if we stopped, thinking about cancer as breast cancer, bowel cancer, all these different things, and thought about it as cancer and came together over it. Ultimately, I'm alive on melanoma drugs that were developed for some, it is this personalized thing. And I think we need to start looking at cancer collectively. And I know that has come out of it in a positive way.
Yeah,
and then
I was going to ask Deb. So, I think that we all, this has gone on for some time now. I think we all do try and look for positive things that have come out of the virus. I mean, amongst anything else, we're all good at working from home as far as we can be, and that would never have happened before. But in terms of good positive stuff that's come out for cancer, so for example, we probably would never have found a vaccine as quickly as we have done had it not been for COVID, where it's been a matter of it's been a catalyst, hasn't it? Do you think that there are similar positives that have come out for cancer and cancer patients?
I think time will tell, but I think there are some examples where there are quite a few drugs in the pipeline that have kind of been in the grey area of red tape, if you want to say that. And for example, the drugs that I'm on have taken a couple of years to be approved in the UK. However, when COVID hit, there was actually an agreement that there was an emergency COVID kind of cancer fund, if you want to say that, and oncologists could apply for a wide range of drugs that were kind of, the data was in, but it's just jumping through the hoops that unfortunately, and it's not right, could take years to be approved. And overnight, it was quite amazing how this red tape has kind of been sidelined and these drugs have been made available. I think people obviously then worry and say, well, it will be taken away. I think everybody I've spoken to have said, no, actually, that just sets the precedent that when something can be done, or we need something to be done, it can be. The same for types of radiotherapy. I know there's still talk about fast tracking kind of more intense radiotherapy, but it can be done. We have the technology, and it's just a case of making kind of those decisions happen. I hope that what comes out of it is a cleverer way of diagnosing cancer. I think we have to actively kind of come out of this saying, hang on a moment, we are going to have a big backlog in cancer. And there is, we can't actually allow that back into the system. I mean, we almost don't have the cancer capacity. I think oncologists will agree that we don't have the cancer capacity to cope with it. So we're going to have to cope with it, not, in an emergency way like COVID, but it is an emergency over a year period, over a couple of year period, getting people back into the system, getting them treated. So we're going to have to be smart about it. Especially at the diagnostics level. So what that looks like, I don't know. I'm not, a politician, but I think I would like to think that we could get some of the challenges that COVID has presented us and apply it to the challenges that we have with backlogs such as cancer. But we as a cancer community need to voice that and remind people that that is still a challenge that has to be addressed, I think.
Yeah. Deb, if you don't mind, I mean, we've talked quite a lot about facts and figures tonight, and that's really important because I think that sets out the context in which we're talking now. But behind those facts and figures are real people. Yeah. And I know that you have seen the devastation firsthand with friends. Your dear friend Kelly, for example, she was someone who died unnecessarily because of COVID and the delays. Can you tell us a little bit about that and about Kelly?
Yeah, so Kelly I actually met Kelly about a year after I was diagnosed. So she reached out to me, and the first message I got from her was, I have just been diagnosed with bowel cancer yesterday. I think she had, Finley must have been 2 at the time, so Finley was her son. She contacted me via Instagram, and we pretty much talked every day since then until her death. She died during COVID. So she was somebody who had stage 4 bowel cancer. She was diagnosed a year after me. Excuse me. And she lived in Manchester, so we weren't local or anything, but I really liked her. I can't describe it. You know, sometimes when you like, I can't describe, this is going to sound, her parents going to be like, what are you talking about? She was resilient as anything, stubborn as anything, and was a real, I mean, grafter in a positive way, a kind of roll your sleeves up, get on with it, don't make a fuss kind of girl. So she would be there going, well, I've just got to take my kid to school, and of course I'll have chemo in between and pop back. It was kind of, she was just one of those people that I had a lot of respect for, because she just kind of got on with the hand that she was dealt, really, at least outwardly. And she, I really liked her, and she, sadly, I don't think anybody for a second was saying that she was going to live forever. But I think when she was 31 when she died. And I think she had a 5-year-old son. And I think, unfortunately, without pointing blame at anybody, very tough decisions based on data that we didn't, I say data, and the reason I'm bringing in data here is when COVID first came in, none of us really knew, or clinicians certainly didn't know where the risks lied. So, you know, hard decisions were made in terms of kind of, no, actually the risk is just too much. And that included just continuing with treatment with somebody like Kelly, who was already, you know, on some of her final options of treatment. But the problem is that, you know, even if those final options are giving you a couple more months, or you get to see your kid to like their next school year, that's a massive, massive deal, isn't it? And she died. I remember her calling me actually a week before she died, and she then went into the hospice about 5 days before she died. And she kind of called me, and she said she was kind of considering a second opinion, but more for hope, I think. She kind of knew that she had come to the end of the road, and she did know that because she had brought her coffin 2 years earlier. But she called me, and unfortunately she was a little bit not with it, because she her liver.
Oh, sorry, I've just frozen, Deb. Sorry, Deb is just frozen, just hopefully temporarily. I'm really sorry. Oh, I think.
Can you see me now?
Oh, sorry, Deb. You just froze temporarily.
Sorry, I don't know what happened there. But I was just going to say, when I last spoke to Kelly, she really wasn't with it. And she said, do you think I should travel? She was going to travel down to London in the middle of a pandemic to see a consultant. And I said, Kelly, do you want to? And she said, no, I just want to sleep. And that was the last time that I spoke to her. And then we talked about, she said, do you think, we'd already filmed with her for Panorama. Mm. It was her decision to film for Panorama. She was a very smart girl, and she knew that she wanted her death to have at least.
Oh, we've just frozen again, unfortunately, at a really sensitive time. I'm really sorry. This is the only problem with Zoom, isn't it?
It's a positive impact. Can you hear me now?
Yeah, yes, we can.
I'm so sorry. I don't know what's going on.
No, that's fine. Don't worry about it. Deb, just thinking about Kelly for a moment. In the Panorama programme, there were some lovely bits with Kelly, and at one of them, I remember her saying that she'd been told by the oncologist that she didn't really need to have any more treatment for the moment. And that actually she was sort of doing okay temporarily. And one of our attendees tonight, Mary Huckle, has said,
Oh, yeah.
surely Kelly should have been given the choice to make her own decision, presumably about treatment. Did she have that decision, or was she told that was it for the time being?
That's a really good question. So I think there's a very fine line between being told and being asked, right? So I can't answer, obviously, on behalf of her family, but I would say she wasn't happy with the decision, no. But every patient has the right to argue against this, argue against the decision that has been made for them. However, they have to also trust that those decisions have been made in the best medical interest for them. Funny enough, I actually, regardless of what views are, I spent the day with Carol Sikora as part of Panorama. And he was really interesting in that he actually had two very close friends on cancer treatment. One of whom called him whilst I was in the room to say, they've just told me that I can't have chemo. And he said, he picked up the phone and he said, tell them that you don't agree with that. Just tell them that I don't agree with that. Now, that isn't right, but it's very interesting that actually, you know, you have to, I think we all have to fight our corner. And I appreciate that people are going to say, well, we shouldn't have to fight our corner. But, you know, even pre-COVID, I had to fight my corner for a diagnosis. I know we all want a perfect system, and that's why we're all here partaking in this conversation to ensure that we can improve the system. But I think the reality is that Mary's right. Actually, if you're not happy with the decision that's been made, you are absolutely within your right to question that decision.
Absolutely.
I wonder if there's any medical kind of professionals here on the call who would kind of contribute to that conversation, actually, because I would be interested to see what they have to say.
Please do. I mean, please comment on that. We really do want this to be very interactive. Deb, just I'm sort of going to come to the end of my questioning, because I know that there are questions waiting in the wings and I don't want to hog all the questions with you. But we can't, I mean, this community, if they could, everyone here tonight, if we could go out and solve all those problems, I know we would. We'd go out and slay dragons. But we can't. Is there one message that you would give to people, not just here tonight, but generally to the general public? Is there one message, if there are people that are out there worried about any part of their health that they know deep down is not right, what would you say to them?
Yeah. So firstly, in terms of the kind of early diagnosis and knowing your body, I think that's the number one thing, is you have to go. GP surgeries are open and they're experts in taking precautions over trying to kind of prevent infection spread. Number two, in terms of people always say, how do you campaign? How do you kind of, get involved with something? My best advice would be to actually speak to other people. Don't do things alone, because ultimately, actually, you're much more powerful, if you want to use that phrase, when you understand what the charities are campaigning for. What do they want? What do they know will help the biggest impact? You as a personal, you as somebody might be saying, I think we all must be screened for bowel cancer at the age of 40. Okay, that's fine. But let's look at this as a wider picture and say, well, hang on a moment. We need to, as a society, just ensure that we haven't even been able to achieve 50 yet. So let's make sure that we get that and we get it right. And I'm not saying it's about the easy wins, but it's about making sure that everybody is joined up, because that's how we're going to make progress, actually, is when we all pull together. And I think it's very, telling of you as a community as well. It is about pulling together for that common goal.
Just before I open up to the floor, I just got one last question from me, which is, if you had any time and darkened room with Boris Johnson and Matt Hancock right now, what would be your message to them?
Okay, so Matt Hancock refused to speak to me, so I'd love to ask him why. I think he's scared of me. And Boris Johnson, I have actually met him. I met him a year ago, a year and a bit ago, just before COVID. And I met him at an awards ceremony for the NHS, where he talked about how wonderful the NHS was. And he talked about how he had used it once for some glass in his big toe. And he then announced to a room full of doctors and nurses and patients that he was going to fix the NHS by ensuring that there was a hot toaster on every ward, because actually when you're staying on a ward, what you miss most is that the home comforts like hot buttered toast. I would meet Boris Johnson and I would ask him, well, A, does he now think that that's a bit stupid? And B, kind of having now experienced.
Oh, we've lost Deb again, I'm afraid. Deb is frozen again. I'm so sorry about this. It's just one of these things that happen. She will come back to us very soon.
How?
Sorry.
Oh, I'm so sorry. Can you see me now?
Yeah, we can.
I'm so sorry. Can you see me now?
Yeah.
I would then ask him, having now experienced it, because it's when we see it firsthand, it's really good for people to see, it's when you see it firsthand, you then know what you want, like, and especially him as Prime Minister, I would like him to now address that same room again and say what he would do for them, because he's seen what they do at 3 o'clock in the morning. He's seen how it works. And I think, that's how I feel, especially in education. You know what it's like when you have no teachers and you have to run a school. So as a result, you kind of what you need to ask for. And I think it's all good and well when people are kind of saying, yeah, we need this, we need this, we need this. But unless you are there on the front line, do you really know what people need? And I think that's what I would say to him anyway. But I would love to meet him again. Yeah, absolutely. Bring it on.
Yeah, absolutely.
I'm annoyed that Matt Hancock refused to meet me for Panorama. He always refused to meet me. I think he just ignores all my tweets and all my I do stalk him a little bit in terms of I direct message him all the time. And he just ignores me. He hasn't blocked me, which I'm very proud of.
So I am really pleased now to throw it all open to the floor, because we've had all sorts of questions coming in. Gosh, right. Well, we've got a long one here, but I would actually like to read it out if that's all right.
Yeah.
I'm sure everyone can see it actually. I think it's a really interesting question. Oh, goodness me. So in practice, you can refuse treatment, but you can't demand treatment if your doctor doesn't feel it's in your best interest. This is, by the way, this is from Dr. Catherine Zolman from Pennybron.
Oh, hi, Catherine. Yeah, cool. Yeah.
I'm a GP trained in medical oncology early in my career.
Yeah.
And Carol Sikora was my boss at one point.
Okay, cool. Brilliant. Hi, Catherine.
So she says, however, you can ask for a second opinion. You can negotiate.
Yep.
You can let your doctors know your feelings and your preferences. And if possible, I would recommend doing that before you get to the point of having to make difficult decisions. Sometimes helping your doctors understand you will help them give you the best treatment. And if they know how you really want it, that might change their minds about whether treatment is actually in your best interests after all. That's a really, really...
That is really good advice, Catherine. Thank you so much. And yeah, and actually, funny enough, I agree. I argued against something and it wasn't overturned. So I had to have 2 types of radiotherapy. One was CyberKnife and another was just regular radiotherapy. And I didn't want regular radiotherapy because I knew that the CyberKnife was more effective. And as a result, I got a very good explanation as to why I couldn't have Cyberknife on the area that I wanted. Hence why I still have quite a croaky throat. And had I been given Cyberknife, I might not be speaking to you properly right now. And yeah, I think that's really, really good advice. Thank you, Catherine. And hi.
Thank you. Just a couple of questions coming in now, Deb. One question here: what is happening with Catch Up with Cancer? As I know, stage 4 patients are still having delays with some treatments.
Yeah, so Catch Up to Cancer was a campaign that ran off the back of Panorama. Kelly's parents led it. I obviously want to support it, and I'm absolutely supportive. I'm not allowed to, because I presented Panorama legally. I'm not allowed to be an advocate for it. But in terms of what it stands for, I absolutely support it. So it's essentially just trying to ensure that certain things that are happening with cancer, such as bringing forward types of radiotherapy, bringing forward certain types of screening, will happen quicker. It reached over 500,000 signatures. There was a meeting with Matt Hancock. If truth be told, I think people like Kelly's father, who are very heavily involved, are probably hitting their head against a brick wall and feeling incredibly frustrated not to see action off the back of it at the moment. I think there hasn't been the great white kind of shining, beacon of hope that I think people wanted. I think the time to do that, and I think the more I speak to charities, I'm going to be speaking to a big group of people this Thursday, hopefully some people who are joining me here now, about, it's not about timing, but I think actually we have to strike when the iron's hot. We need to make sure that we don't jump from one crisis into another, which is exactly how you started this conversation, Liz. And I think it's ensuring that people don't just assume, right, we've got vaccines, life can go back to normal. So it's ensuring that we don't kind of make it go anywhere. The second part of that was when stage 4 cancer patients are being denied. What my question to that would be, what it's about getting the examples of that. So obviously, agree with you. The challenge is understanding what that looks like in practice. Does that make sense? Because it's kind of seeing where it's happening. Is it pockets of practice? Is it particular case studies? What does it look like?
And on that note, actually, Deb, from Emma Robertson, she says, what is being done to restart cancer care, and how can patients get involved with feeding into that reboot?
Great question. So I have a meeting that I'm going to be speaking at a meeting this Thursday with Macmillan and Cancer Research UK. Collectively, a lot of charities are coming together in terms of it's behind something called One Voice, which is essentially a manifesto like outlining what does it look like moving forward? What does the roadmap to restarting cancer care look like moving forward? And obviously, people are calling for a variety of different things in terms of protecting research. So one of the biggest things at the moment, obviously we have the front line, but we have to remember the impact that the lack of funding because of all the events that have been cancelled has had on charities such as CR UK, who fund so much in terms of research. And the reality is, when you have £400 million of funding stopped because of COVID, we have to call for that to be matched somewhere or to be found somewhere, because that research is saving lives. So it's how can you get involved with it? The biggest thing for me would be to get involved with a charity and to work alongside a charity for whatever reason. So that can be your local community, like you guys in Bath, and to find out what are the needs in the local area, what are the things that you care passionately about, and how can you get behind those? So I think I can't answer that for everybody, because we all have different reasons. It might be supporting your local hospice to champion what they need. It might be, for me, it's kind of wherever you're passionate. It might be early diagnosis, it might be research, but the more voices, the better.
Deb, on that note, actually, someone suggested that you might like Matt Hancock's job.
I'd love his job. You wouldn't even have to pay me as much.
And just, well, I mean, probably crazy question off the cuff, but if you were invited to take over from Matt Hancock tomorrow, what would be the first thing that you would do?
I'd ask the people on the ground what they want to do, because I think actually you realize that we have, it's the same as teaching, isn't it? Like, having worked in public sector work, you realize actually sometimes you have to leave systems to the people that work in the systems, and ultimately, you know, you can have control in terms of kind of at certain other levels, but ultimately there's a lot of people on the ground who know exactly what needs to be done, and then obviously we have to look at it as a bigger picture. But yeah, I'd start by actually asking the excellent examples of practice exactly what they think should be needed. I'm sure that's happening.
Yes, well, we hope it is. Yeah,
we hope it is.
And also somebody has asked about on Thursday, it's World Cancer Day.
Yes.
Obviously you'll be involved, as we all will be, and we get it, and lots of other people across the country, well, across the world actually. What would you like your message to be for World Cancer Day? I mean, I'm sure there are lots of messages, but if you have to say one, what do you think that would be?
Okay, so the overarching theme for World Cancer Day is I am, I will. So it's I am Deborah.
Oh, I hope we're going to find out what you will, Deb. Deb is frozen again. Sorry about her. We've got a slight glitch, a slight gremlin in the system, I'm afraid. When we get Deb back, we'll find out what it is that she will. And we can also ask her, we have time to ask her a few more questions. Deb, you've frozen. Can you get back to us? We've got a few more questions here. I do advise you. Oh, I think we've lost Deb altogether. I think what's happened is that she's probably left Zoom in order to come back in again because she was frozen. Please do carry on putting questions either on the chat or the Q&A. We have a little bit of time left with Deb, and I really want to make sure that as many of your questions are answered as possible. And I'm sure that those of you who have got questions can also get in touch with Deb via social media. As you know, she is very active on social media. So,
hi, can you see me?
Yeah.
Apologies. What I'm trying to do is now run it from my phone on 4G to see if it makes any difference.
Okay. Well, Deb, you were just
so
saying.
Sorry.
No, don't worry, it's fine. I'm sure people like to listen to me gabbling away about nothing. So, just you were saying.
I live in London. It's ridiculous. It's so ridiculous. This whole, like, I don't know what it is. Maybe my whole street is like streaming Bridgerton or something.
Or maybe they're all looking at you, Deb. You were saying about World Cancer Day and it being I am, I will. We heard I am Deb James, but what was your I will?
Oh, good question. So I will continue to ensure that cancer is not forgotten about. And the whole theme of World Cancer Day is for us to individually make a pledge globally to come together to ensure that cancer is not forgotten about in our own way. So it doesn't have to be a big gesture. It can be whatever it is. So it could be telling your neighbour to go and check their poo for the day. It could be reminding your girlfriends to check their breasts. It could be the tiniest thing. It could be a global thing. It doesn't matter what it is, but it's just making a tiny pledge on one day.
And Deb, I'd like to ask you, I mean, you're such a force to be reckoned with, and we love you very dearly. What would you like your legacy to be?
Oh, good question. Probably a bit bonkers, that's fine. So for me, it's the education side. So that's why I do what I do, because I think I would, you know, if I could live forever, I would go back into teaching, actually. And I always think about that. I always think, is my cancer going to just go to sleep and then allow me to go back into teaching, you know, as a head teacher. So this for me, in terms of kind of, is just broadcasting and writing is education on a different platform. So my legacy, I hope, would be to teach others. So you plant seeds. So teaching is about planting seeds that will grow one day, and you probably will never see those trees that will grow. So it's, the question is, what seeds are you planting right now into the orchard that other children will sit in and play? So that would be my legacy and my question to people.
And for all of us here tonight, listening to you, and obviously those people that will tune in later, do you think that there is sort of one message that you'd want to give out for us starting the new day tomorrow? I mean, is it, as we've been saying in our campaign, is it get it checked? Is it feel your own force and be clear about what you need and what you want from your GP or other health professionals? Is it, I mean, is there something that we can take responsibility for, that we can do? We can be proactive ourselves in order to make a difference?
Oh, good question. I think it has to start with ourselves first, doesn't it? So I think the thing that we've all learned, probably, I'm hoping that we've all learned, is that actually we're living in a pandemic. It's a roller coaster. We have rubbish days, we have great days. So if you wake up tomorrow and you feel awful, that is fine. And I think actually, you know, from all of us in the cancer community, I think we can all appreciate, just in terms of, because of COVID and because of cancer, just how precious waking up to another day is. But that doesn't mean that you have to go and smash it. You know, just appreciate the fact that actually, if you're sitting outside and you're watching some trees blow in the wind, then actually that in itself is a blessing, isn't it? It doesn't mean that you have to feel happy about it. So I think it has to start with us. So in terms of doing whatever you need to do to make yourself feel happy or functioning or whatever it looks like. And if you're having a rubbish day, pray to get another one, and then, you know, it's a roller coaster. But in terms of, from a practical perspective, it is just that championing, like, what are you passionate about? So are you passionate about championing early diagnosis and knowing that actually, had your cancer been caught early, or if we catch cancer early, then actually that is the difference between life and death. So, you know, you're reminding, start with your nearest and dearest. And I think it's kind of, a lot of people say, well, where do I start? You've got to start with the people around you, right? So I started blogging it started with my family and my friends, and then it went to my teaching community first. And that's how my blog and my Instagram started, because it went to the people that I was most in contact with first. And I think you have to start at home, don't you? You have to start with those that you care about the most first. And then if it trickles, amazing. But could you imagine if we're all doing that bit there, how it could join up and be quite an amazing thing?
And I think also one message that I think you've been very clear about, certainly on social, is that the NHS is open. It's not closed for business. It's open. I mean, one of the things that Laura Phillips, who you know, has said here, is the GP incentive, the QOF scheme, has been changed. Priorities getting cancer referrals and cancer screening back on track. All practices have put an action plan together that spells out actions that they're going to put in place to get cancers diagnosed earlier. It's come at a time when, unfortunately, GP practices are trying to deliver this massive vaccination program, but
doing it very well.
Yeah, but GPs are really keen to do what they can. We want to, and I know you will, encourage people to come forward if they have symptoms that they're concerned about. Practices are open. GPs are seeing people with suspected cancer face to face. And although some people are not always turning up to their hospital appointments because they're scared, the danger is almost certainly worse from delaying the cancer diagnosis than it is from COVID.
100%. Yeah, we know that. And I think, Laura, thank you very much. Laura, I want to know more about what the directive is. Does that make sense? Because I've seen that as well, and I think it's a really positive move, but obviously I'm not a GP, so I don't know the ins and outs of it. But I think it's also reminding people that it goes back, and I'm not going to repeat it, it's the door on the handle conversation. So it's asking yourself, what is the door on the handle conversation? It's asking your dad, your mum, your grandmother, your best mate, what is your door on the handle conversation? And it's kind of getting them to present that to their GPs. Because yeah, I totally agree. The collateral from COVID can't be cancer.
Yeah. I mean, Deb, there are still many questions coming in. I am aware that, as we've talked about, there is an attention span, and I don't want to push it too much with everybody. One last thing that's come in through here says, COVID has shown us how important learning how to build and support our own resilience is.
Yeah.
Eat well, keep physically active, connect with people and things you love and the things that you feel passionate about. It's so wonderful to see Deb in action. Your passion is a powerful life force for other people with cancer, for the world, and I'm sure for yourself too. And thank you.
Oh, who's that? Thank you very much.
On Laura.
Laura, thank you. That was a very nice comment. And I agree, not about me being like nice, but I agree about the resilience thing actually. It's something I'm writing about that at the moment. So I used to do a lot of research about mindset in schools. And it's how do you teach growth mindset? How do you teach resilience? And I used to study it 20 years ago. And then if anybody has children, they will know that built into the primary curriculum now is kind of learning to learn, resilience, mindset. And that was based on clinical trials that we did kind of like 15 years ago. But the reality is kind of actually, it goes back exactly to what I said in terms of it has to start with yourself. And people say, how are you so positive? I'm not positive all the time, actually, to be honest, but I know what my tools are to pull me up. So honestly, I had a really rough time in ICU a couple of months ago. And I was pretty taken aback by how low I went to the bottom of the mountain in terms of my recent recovery. But I have my tools, and my tools are my family. My tools are exercise. And then off air, myself and Liz were just talking about kind of I've been vegetarian. Food is really I've actually been doing veganuary. Food is something that is really important to me, not in a kind of really snobby, I can only eat this, but in a I have to listen to my body and know what to put in it. And I was saying that actually my liver function has finally improved since I've been doing veganuary. I have no idea whether that's a connection, but it's kind of listening to your body and saying, okay, what can I do to make me feel better? Not because an influencer or a celebrity is telling me to do so, because my body needs it, whatever it might be. And it's not about not having, I still drink wine and I still all the time, and I still kind of eat chocolate all the time, but it is about kind of having a bit of a balance but I know, for example, if I don't exercise or do something physical, then I don't feel very good, actually, mentally. So it's my question is, resilience wise, what are your tools? And if you can't find any tools, then please ask for some help, because maybe you need some help with other people to help you find your own tools. Does that make sense? Yeah. And I think there's no harm. I've had to hold my hands up so many times and say, help, I don't know where to start. And I think there's no shame in that either.
So with all that energy that you have and your love of exercise, would that mean that we will see you on Strictly?
No, I think, oh God, I'm not even getting, you'll get me down in an entire other debate. I think no, I would love to dance and do stuff like that. But I think, unfortunately, Strictly aside, I think, this is going to now open an entire other debate. quite often you will find, I'll say this, but people will go, oh God, Deborah. So for example, we've just had another stand up to cancer, and I support stand up to cancer all the time, and we'll have another celebrity bake off, which is great, and it's fine. But I find it very sad that once again, there's not one person who has cancer on it. There's not one person who, it's always us and them. Does that make sense? So I think it's yet again doing a disservice to valuing people on the same level, and so it kind of makes a bit of a mockery of the whole thing in terms of, oh, you have to go on Love Island to then represent cancer patients. So I think my response to kind of like that would be like, cancer patients, we're not victims and we're not stupid, and we can represent ourselves. And I think communities like tonight, and the people listening in, and what you guys do, I know in Bath, is exactly that. And actually, that is more important, and that will make a lot more change and is more important. And I hope one day producers and people will catch up with it. For me, actually, doing the panorama I was really honoured to do that, because the producer, it was the first time actually that a big producer had said, no, I want you to present it. And they took a massive punt on that, actually. But they said, well, they knew exactly what they were doing. They said, why am I not going to get a cancer patient to present about cancer? And I thought, wow, actually, that is exactly right. And I hope to see more of that. Not just me, like lots of people. There are so many people championing, talking about things, doing brilliant things in our community. So I hope that they will get bigger and bigger platforms to do it on, and don't need to be represented by Love Islanders. Anyway, that was a really roundabout, slightly bitter, not a bitter, but you know what I mean, response. Anyway, please feel free to comment on that.
I think, Deb, that you've given us an amazing insight this evening. I just want to thank you on behalf of everybody from the We Get It community, but also from all the people that have attended this evening. I really hope you've all enjoyed it. I'm sorry that we've had Deb freezing from time to time. But
sorry, that was my fault. Apologies.
That gave you a little bit of respite from all the talking. So that's good, positive from that. We've had lots of thank yous through on our chat and our Q&A. Thank you everybody for your questions. I'm really sorry that we can't get through to can't mention everybody's question, but we probably would be here until midnight if we did. But there's a lot of energy, and I'm really thrilled with being able to have heard Deb tonight, and all I can see is her hand.
Apologies, I'm reading some of the questions actually, just to ensure that we haven't, like, I know that you've been on it as well. I was like, oh yeah.
I was just saying, while you went off, actually, Deb, I was just saying that if people did have questions that they really wanted to speak to you about, that they could do so on social. They could contact you.
Absolutely. Via Instagram or Twitter. Twitter, to be honest with you, Twitter's better, because my Instagram gets a bit clogged up, and then Instagram kind of like doesn't allow me to see messages. So Twitter's actually better for me, because I don't have as many followers, and it's just easier to access me that way.
Yeah, and it's good that we know that we can contact you, because I'm sure that there are still burning questions. And I just want to thank everybody who's attended.
Thank you very much for spending the evening. Can I say thank you as well to that?
Even though we can't see you, we know you've been a fabulous audience. But obviously a huge thank you to Deb for giving up your time, for giving us your insights and your amazing energy, and sharing your quite deep thoughts and experience with us, because we feel really honoured for that. And we'll be following you on all your social channels to see how the journey goes.
Thank you.
Thank you very much, Deborah James.
Oh, thanks for having me, and I can't wait to actually come back to Bath. I need some more afternoon tea.
We'll make it happen. We'll
absolutely make it happen. So yeah, no, looking forward to it. Thanks so much. Take care. Bye.
Bye.